I first decided to be a doctor when I was 17 years old. I became a doctor because I found that helping people by improving their health was gratifying, and you actually were able to see your impact on someone else's life. I became a pediatrician because children to me seemed like they were more in touch with other people. So when a child feels pain, he shows it, he tells it, and if he can, he actually show you where the pain is.
My daughter's name is Regina, and she's 7 years old. She is a hard-working girl. I sent her to live with a grandmother who is helpless and needed someone to help around the house. A grandmother told me that she had malaria. I decided to come and take care of her. I'm afraid of malaria. I know for sure that it kills kids. I know of a neighbor whose child died of malaria.
A lot of children still die from malaria. Any infection that comes in with a fever, with diarrhea, a cough, we usually have malaria as our first differential. Children are more vulnerable to malaria than adults. The child immune system is still getting to know its environment. It's still adapting, it's still beefing up. So when it's exposed to malaria, it doesn't have the strength to fight back as much as an adult immune system. Before someone comes for help to the hospital, the malaria has usually dealt a significant blow to the child.
My daughter is Levian. She's 5 years old. She's in nursery school and was brought home Tuesday by another student. She was shivering very much, and by Friday when I touched my daughter, she was very, very hot. And I asked myself, what will I do? If a child gets sick in my area and you don't have the means, you just buy Panadol and give to the child.
By the time to get to us in the hospital, we're usually starting behind the starting line. We try to rehabilitate the patient before we start treating them. It's a setback, given that in our setting, we usually have reduced resources. The death of a child is very devastating. That's the most. When you see a spark of light that actually goes off, when it had so much potential into affecting or bringing light to a lot of people and a lot of areas, all that potential, seeing it go off, it's very devastating.
I'd like my child to reach higher education, to close the gap that I left. I'd like my child to be a doctor. Even people in my village respect a doctor.
The best way to reduce the mortality rate on malaria-infected children, I believe, would be educating the masses. When you refer to poor communities, it's a big challenge. The masses outweigh the resources we have for health provision. There are a lot of people who are being left out.
I hope God opens the doors of my child's ability. If she gets well by the grace of God, she can have a good education and her life turns out well, and maybe she will help me in my old age. The first thing I will do when I leave this hospital and enter my house is thank God. My child has been saved from the hands of death. Then, after being thankful, I will see what next.
The only way we can change this great obstacle we're facing, I believe, is coming together, reducing the gap, and all of us working towards a similar goal.